Hello, I'm Nyla Goldenberg from Functional Endocrinology, and today we're talking about stress as a root cause. And we're going to talk about what is stress, how stress affects our bodies, and what are the tips to reduce stress. So stress, there are different versions of stress. There is physical stress, where we have, for example, ultra changes in temperatures, very high temperature or very low temperature. Change in atmospheric pressure, for example, if you are climbing the mountains or if you are diving, then radiation can create stress, physical stress like fracture or injury. And there are stresses, for example, lack of food, hunger, or sleeplessness. That's as well as stress. And then there are emotional stress, and there are stress, eustress, and distress. And there is acute stress, which comes and goes. Episodic acute stress. There is a chronic stress and post-traumatic stress. The eustress is considered to be a good stress, and it could be acute stress or chronic. And eustress supposedly a great place to be when you are a person who loves their work, finds it challenging, fulfilling, and it still helps you to grow and develop and be more creative. The acute eustress, positive stress, for example, you are running 5K and you are happy with that, or wedding is a stress, or good stress. But then we have chronic bad stresses. Chronic bad stresses, for example, person working at very stressful job and not liking that, or being in a difficult relationship. And there is acute bad stress, short term, where you went and you've met some bear, that's acute stress. Or there could be, of course, as here, death of loved one or serious accident. So those are 4 types of stresses. Why do we talk about that? Because, for example, with my adrenal insufficient patient, I have to remind them constantly that acute eustress or acute stress, they still require updosing of steroids.
And I don't know why that's hard for us,
Yes, and
but it is very hard for us. I mean, Ted's really good at reminding me, "Oh, this is still stress. You need to updose."
yes,
I don't know. I don't know why we just
don't think about that.
yeah,
And frequently patients do remember to updose for bad stress, but completely
not
forget for good stress. And it's important to remember to do that. Um, and there are different stages of stress, which for some reason doesn't show up here. Oh, here it is. So we have acute stresses, or eustresses, they come and go. Then if you have chronic stress, you get into that attempted adaptation. Then you get into exhaustion and distress. The cortisol has very strong association with stages of stress, and you can see that cortisol goes up and down depending on your stress. With resistance, it stays up, and then it starts going down. And with exhaustion, the cortisol level can go down. It may not be necessarily in pathological adrenal insufficiency range, but it's definitely is not completely normal. And if you do 4-point saliva cortisol, you will see that there is a wrong pattern for the cortisol pathway, cortisol levels. So besides cortisol, there are other hormones that involved. You can see here, depending on where you are in your stress, you could have involvement of serotonin, norepinephrine, epinephrine, DHA, all of those. So it's not only adrenal glands that produces the hormones, but it's hypothalamus, pituitary, and all of those symptoms play together and play different roles in adaptation. and have patterns of changes depending on where you are with your stress response. Again, why is important to know or do something about stress? There is a fair amount of research starting to accumulate that shows that high stress, frequently perceived as depression, is associated with coronary artery disease, heart disease, and cardiovascular death. For example, in big meta-analysis of about 324,000 people, the ratio of association for depression and myocardial infarction and coronary death was 31 to 36% higher. So just having this high stress and depression is a huge risk factor for cardiovascular system. Another study that included more than 500,000 of people, depression and all-cause mortality and cardiovascular was 32% higher compared to people who didn't have depression. And people who found loneliness and restless sleep had 21% more cardiovascular incidents episodes among 12,000 people. The Mesoside study, which is a big study in the United States that followed people for about 8.5 years, there was, again, a significant association between high chronic score, chronic stress score, and depressive symptoms with cardiovascular disease. And opposite, if people had emotional support, that risk was less. Plus, there is some evidence that stress and cancer are as well have association or maybe causation. Stress induces epigenetic changes, and because of that, severity disease and prognosis of the disease in cancer patient can be different. And it appears to be that emotional stress can enhance the invasiveness and proliferation of tumors in different cancers. And we know that stress changes hypothalamus pituitary adrenal axis. It does affect circadian rhythm, which means changes your sleep rhythm, sleep-wake cycle. It deregulates immune response, and probably because of all of that, it contributes to severity of different cancers in the study. This particular study looked at genes related to stress in people with breast cancer who had metastasis or who did not. And people with metastatic breast cancer had a lot more stress-associated genes working actively compared to people who were not, who didn't have metastasis. And of course, it's maybe hard to know what is egg, what is chicken here, but still, there appears to be association with stress and cancer. Besides all of that, the elevated stress hormone, we talked about changes in sleep. Frequently, it's associated with weight gain. When we have higher weight, frequently we have more chance of developing diabetes. There is increase of inflammation in general, worsening of immune response. Because of that, a higher chance of getting sick or having dysregulation, autoimmunity, cancer, and so on. Our machinery works more, and we have overutilization of our minerals and vitamins and high chance of developing deficiencies. Our sympathetic and parasympathetic tones change, and that is associated and contributes to leaky guts, and of course to anxiety and mood issues and depression. So there are different ways to cope with stress. You could be self-soothing, for example, having stress ball or stuffed animal, having stress having actual real animal who will be your companion, and you could use that as therapy animal. Music can help, different meditation guides, things to see, happy pictures, happy memories, something to taste, but something to taste can lead to increased eating, and that may not be a good coping skill, or a good coping skill that goes wrong. And of course, something to smell. For many people, smell is so strong, and if you have certain smell associated with good memories rather than with bad, having that smell, bring that smell back, can help you to improve your mood and reduce your stress. Then you can try to distract yourself, for example, doing puzzles, reading books, doing artworks, or looking at artworks, doing different crafts and knitting and crocheting and so on. Again, if it goes too far, you could be spending hours and hours scrolling your Facebook or Instagram, watching the happy kitten videos and not being productive. So everything, coping skills needs to be done within reasonable levels. Okay, and then you can try to do opposite action. So if, for example, you have certain impulse that makes you stress, you may want to try to do the opposite action. And affirmation and inspiration, looking or drawing motivational statements, maybe creating vision boards, all of that becomes very good opposite action. Then it's important to be emotionally aware of what is happening, and keeping journal, have a list of charts of emotions. All of that is a good way to do that. Mindfulness. Mindfulness is meditation, relaxation, and we'll talk a little bit more about that. It's great to have those as your daily routine tools. Crisis plan is great because if you have, as we say in the program that I coach, if you fail to plan, you plan to fail. So if you plan to have plan B or plan A for different stressful situations, and you know what you're going to do, that's a great way to avoid destructive outcomes of your stress. So please use your resources, have family, friends, therapy hotlines, 911, and so on. So stress management. First, it's very important to realize that there is a stress. If it's possible, removal of the stress is the best, but if it's not possible, maybe changing the mindset about the situation. That's where the therapy or counseling could be very useful. Then you could utilize supplements, adaptogens, and we'll talk more about that. Exercise is excellent for stress management, meditation, different self-improvement courses and classes, seeing a physician who may check you for cortisol, neurotransmitters, and nutrients is as well important, and possibly even medical treatment. On the right, I like the chart that shows that we are technically can have control over ourselves, a little bit toward our partners and children, and less extended family, friends, neighbors, then employers, schools, professional acquaintance, and government and social networks, and even less so interactive network and service providers. So realizing that helps us to, our main job is to make ourselves happy, and as in an airplane, put the oxygen on yourself, make yourself better, and then you can help others and do it to your best abilities. So meditation is I like the definition to engage in mental exercise, such as concentration on one's breathing or a repetition of mantra for purpose of reaching heightened level of spiritual awareness, and other to focus one's thoughts on and reflect on or ponder over, and to plan or project in the mind, intent, purpose, he was meditating image. So I like obviously the second intrinsic, because that reflects what is meditation in my mind. Types of mind or types of meditation, there is a non-guided where you just focus on your breath, focus on mantra or objects like you have beads, and that's not guided, you're just calming yourself. And guided is to me much easier because guided meditation provides you with actual things to visualize, it gives you a plan, it gives you subject to focus on, and because of that it is much easier. There is spiritual versions of meditation such as different prayers, movement meditation like yoga, tai chi, qigong, just reflection where you write in your journal. There's sound meditation when you listen to music and that brings you into meditative state. Art therapy, usually provided by specially trained therapists, and just color meditation, what I call coloring, and it creates color meditation state. The making art significantly reduces stress levels regardless of artistic talent and experience. And in this particular study, cortisol level was significantly lower following this session. And 75% of people demonstrated that lowering of cortisol level. And it did not matter what was your experience with art making, media choice, race, gender. There was slight difference based on age and time of the day. And that's why I do art, and I actually started taking course through Prima Learn for art therapy, and there were several things that I copied from there that went through or went over the coloring. So coloring helps people to relax, and it puts you into state of mindfulness. On the other hand, it people utilize both analytical and creative function of the brain, because you have to choose and pick shapes and colors and use your imagination as well. It's excellent for both children and adults, and it helps you to get into that meditative state and find the meditative thoughts. Mandala is one of the best ways to color meditate. You can create your own mandala, or you can print out multiple mandalas that are available for free on internet, and then you can utilize that and pick up your colors and do the meditation. Mandala in general is in Sanskrit means round, circle, and in Tibet, mandala creation is a sacred ritual. Yes. People use colored sand and spend hours and days creating those colorful mandalas. And they do that together with the praying and with the special sounds. And at the end, they give the mandala to God, to Buddha. Thus, they actually destroy it. And that allows you to understand that nothing is permanent, and we should let go of things. So there is definitely several layers of psychology there with mandalas. And creating colorful mandalas just on the paper is still wonderful exercise. It requires aesthetics, creativity, respect to the centralized organization of mandala, internal order, and mental stability. It helps us to soothe and reduces levels of anxiety. Zentangle. Zentangle is interesting form of art where you can utilize pen and pencil, pencil, different versions of colors, and just paper. And you can see that it's can be part of therapy when you have, or you can do it when you have free time. The idea is not to express the emotions, but to focus on relaxing aspect of this artistic practice. You don't have to have super much of experience in doing Zentangle. It's very simple, and because of that, you express yourself freely, and there are no rules. You just draw structured and repetitive patterns, and it's kind of similar practice to wild style or graffiti, and it entails making random drawings and in all kinds of situations. Maybe you talk to the phone or listen to presentation and you doodle something. That's technically Zentangle. So I would actually encourage you to do this exercise when you will take maybe cut off a square 4x4 inch, draw some kind of shape in which you will be painting. Then you take marker or black pen, you draw several curves inside, and you start using different structures to draw, and just section by section fill it out with geometrical pattern and repeat. And there are no mistakes here. You just do whatever feels right, and feel yourself relaxing. So if you want, take a screenshot for this exercise and maybe try to do that. It's actually a lot of fun.
It reminds me a lot of what I just discovered called neurographic art.
Yes, correct. Yes.
And I have zero artistic skills, abilities, or I mean, I can't even match my own clothes. I don't understand color. It's just not, it just makes no sense to me. But this I can do.
Awesome. Keep doing
I
that.
mean, and I have 2 daughters who are
Super artistic. I know.
they are incredible artists, and obviously they didn't get it from me. I mean,
Who knows? Who knows?
yeah.
So yeah. So the colors are very interesting. Colors is a perception of wavelengths, and not everybody sees the colors the same way. Obviously, people who are colorblind have different perception, and there are different versions of color blindness. There are 3 types of cones, the cells that can help us perceive the colors. In majority of people, it's 3 types. And depending on color blindness, you can lose different version of the color, and because of that, your perception of nature or everything around you will be very different. Interestingly, that diabetics can see perception of colors differently depending on their blood sugar level. It could be more orange, more yellow, depending where you are. And I remember back in Russia, I had a life coach who had that ability. He actually patented, I think, something related to color perception and blood sugar levels. So as I said, majority of us have 3 different versions of color receptors, but there are people who actually have 4 types. And for example, this Conchetta Antico, she has 4 types of cones in her retina. And because of that, her perception of color is even more acute. So you can see here her work, Gum Tree Landscape, and you can appreciate how many different varieties of colors are there. And again, if your nature, your genetics, or whatever didn't give you 4 versions of cones, maybe you cannot appreciate all the details, but still you can see how beautiful the painting is. And if you choose to be to try to paint, you still can create different things. And as I'm learning, you don't necessarily need to have a strong talent. Talent helps, but everybody can learn how to paint and definitely how to color, especially if you have some kind of mandala that's already pre-printed. You just color in, play with colors, and enjoy this state that you get relaxation and meditation and so on. So there are apparently effect of different colors on your mood, on your memories, and depending on your previous life experiences, certain colors can trigger certain memories. Some of that could be even subconscious, but you may realize that this color you like because maybe it reminds you of your favorite grand aunt or favorite whatever situation it was. In some studies, certain colors have apparently well-defined effect. For example, there was study showing that if you install blue public lighting, that can reduce crime rate. There was another study where students before exam were given red labels or green labels, and a red labeled team was less successful in exam, which is of course sad. And some critics of that study said that it's probably hard to accept the results of that, because different cultures, they do accept or they do perceive color differently. For some cultures, red could be very aggressive. For some cultures, it could be very festive, and so on. So technically, depending on your background, you could have perception of different colors, could have different perceptions. For example, in some cultures, in many cultures, black is associated with mourning, but in others, it's actually white what is associated with mournings, and so on. And if you imagine about effect of colors can be temporary. If you, for example, just painted your room blue and that soothes you out, and every room in your house is blue, soon enough you will not perceive that blue color as soothing as it was initially. But I believe if you have different colors in different room, walking into, when you have that change from one color to another, can create and cause temporary change in your mood as well. From perspective of art therapy, each use of the color, that's what important, and that's what revealing, because when you start talking to people why they use this color or the other, their emotional memory will be jogged, and they will be sharing with you what happened. And when they do that, that's when they can reconnect with their emotion and can help to resolve those emotions. Other important part about colors is marketing. Marketing people are taught which colors to use for different reasons. And for example, social networks usually blue because it's soothing, inspire confidence, makes people want to communicate. It's even better when it's combined with white. And usually red you wouldn't want to use because it will seem very aggressive, and so on. And I do remember watching different movies and mini serials about presidents, for example, and how they choose their colors for to go and give some kind of speech, and pick the ties, pick their color and stripes and whatever accessory needed to be for their attire, because that apparently can provide you or be associated with certain emotions that you can feel toward that particular person. So yeah, colors are very, very important. Chromotherapy is actually how color could be used in environment and can help us heal. Apparently, green color is associated with anti-allergy and antibiotic virtues. Magenta is used as aphrodisiac. We talked about red color therapy and blue light therapy before, so technically it's to some degree chromotherapy. And in art therapy, as I said, it's more important why people choose when they apply the color and what color they apply rather than what everybody in society thinks about those colors. Because you may think certain association, you may have certain association, emotional connection with different colors. And because of that, you may pick and choose different colors for different parts of your painting and so on. So one more thing which I like for stress reduction is Ho'oponopono, which is ancient Hawaiian mantra. You want to close your eyes, imagine somebody in your life whom you want to heal your relationship with, and repeat 4 phrases. I'm sorry, and then you can add what you're sorry for. Please forgive me. It doesn't matter whose fault it was for whatever issues you had in your relationship. So just say, please forgive me, and then I love you and thank you. And repeat those phrases several times. You can do that 3-4 times a day. And if you do that consistently, apparently that can help to heal that relationship with this prayerful intention. So Ho'oponopono, very cool exercise, and I've done that myself. Of course, you can use adaptogens for if you have stress. Adaptogens, there are different versions of them. They help you to adapt to that stress. And rhodiola, eleuterocoque, schisandra, ashwagandha, licorice root, adrenal concentrates, they have slightly different effects on your cortisol level or catecholamines. And I try usually to utilize them depending on what's cortisol level in patients' saliva throughout the day. But you could use small amount and try to see what works for you one way or the other. You do want to have good supplements with B vitamins because they do help to protect your adrenals and reduce your stress, improve your sleep, help you with production of serotonin and melatonin, which tryptophan turns into serotonin, serotonin turns into melatonin, helps with the sleep. Then you have cofactors for creation of GABA, and GABA is very good relaxing neurotransmitter plus the same P5P, which is vitamin B6, helps with production of serotonin and dopamine. And then we have methylcobalamin, which is a methylated version of B12. It resets circadian rhythm to improve sleep and normalize cortisol. And methylfolate, which is version of folic acid, super important for neurotransmitter formation. And there are some supplements like DIM, diindolylmethane, that helps us to reduce some of the stress hormones like catecholamines. And having all of those nutrients enough in your diet or as supplements is super important during the stressful times. Having enough of protein in the diet, good fats like omega-3s, more than omega-6s, less of simple carbs, that as well helps with to deal with stress better. And that's pretty much it for right now. Because of that, I am going to stop the recording and then we will pause the sharing.